The cure for American healthcare. What can be done about the cancer that is consuming the American healthcare system, that is stealing our money and denying us the healthcare we need? The cure. Direct Pay USA. This is Dr. Deane, and welcome to my webinars on healthcare. For those who don't know me, I am a professor emeritus in pediatrics, pathology, and decision science, and currently serve as the consumer advocate on the board of directors of the New Mexico Health Exchange. I'm honored to say I'm the author of the book, The Cancer in the American Healthcare System. In this series of webinars, some of the titles you will find include What's Really Happening in Healthcare, Should I Buy Health Insurance or Not? Rather timely. What Would a Good Doctor Do? Is the Affordable Care Act the answer? Single payer and other fantastical beings? Today we're going to talk about the cure, Direct Pay USA. There's another one on why we don't need tort reform. Today's discussion, we're going to start with the root cause of dysfunction in our healthcare system. We're going to ask and answer the question, who's the right doctor to cure our sick healthcare system? We're going to discuss Direct Pay USA so you understand what it is, including how it cures our sick healthcare system. Obviously, we need to talk about the money. And then, of course, we always end with what next? Now, the root cause of anything is required. You have to know it if you're going to cure a patient, an animal, or a sick system. Unfortunately, our Washington people treat symptoms and they don't even know, or at least they reject, the root cause of healthcare dysfunction, and therefore they don't treat it. The root cause is cancer. Cancer of the federal bureaucracy. What is cancer? Well, cancer is basically an abnormality of a part or a cell, and it does three things. It refuses to do its normal function. It grabs all the energy it can find anywhere, and it grows and grows and grows until, well, you know what happens. For instance, in your body, suppose you had cancer in your intestines. The intestinal cells wouldn't absorb food anymore. They would steal all the energy they could find from your blood supply in order to fuel the growth of the cancer. Now, in healthcare, the cancer is located in the federal healthcare bureaucracy, and it too ceases to do its normal function, refuses to do it, which is to help all the rest of the parts of society and healthcare. It steals all the energy it can find. The cost of Obamacare is over $2 trillion, and pretty much all of that goes to the bureaucracy, not to care. And unfortunately, the bureaucracy has grown and grown and grown until now it consumes half of all healthcare spending. So waiting for Washington to fix healthcare is literally like expecting cancer to cure cancer. We knew this a long time ago. One of our very wise founding fathers, Thomas Jefferson, said, most bad government has grown out of too much government. Now, since the root cause of the cancer is excessive government control, the cure is somewhat obvious, and that is to reduce government control. Unfortunately, Washington will never voluntarily reduce its own control, so we must do it. Direct Pay USA is an approach to do just that, and it will cure our healthcare system. It does so by curing the cancer, which means that it cuts government control. Now, you understand, of course, that if you reduce government control, you increase personal control, which also means you increase personal responsibility. Basically, Direct Pay has every American with a health savings account, or HSA. Every American pays for his care. Don't get scared, you'll have the money. Everyone buys catastrophic insurance. That's basically the three parts of Direct Pay. Now, I love this graphic that a brilliant artist created for me. What it shows, what it demonstrates, is that Direct Pay USA restores the direct connection between the patient and the doctor. And there's no government or insurance company in between you and your doctor. Now, under direct pay, the consumers shop, and they shop carefully because it's their money they're spending, and the sellers compete. I wish I could tell you that I'm the one in the blue jersey, but that was a long time ago. Anyway, because the consumers shop and the sellers compete, we have free market forces, and that results in increased quality and decreased spending. Now, specifics. Okay, let's get to them. Every American gets his own personal HSA. The HSA funds pay for medical care, and that is decided by the patient, not by anybody else. Unused funds can accumulate indefinitely, and within a family, you can commingle the funds. So if your wife has a major problem and you have the money, more money than she, you can use your money to pay for her care. The government has two basic roles. One, licensing, so you actually know that the doctor you go to has a valid license. And number two, they verify that those outcomes that the local hospital reports, the 99% survival after heart surgery or whatever, the government verifies that those outcomes actually are true. The government does not determine your care or pay for your care under Direct Pay USA. We all obviously have to get to the money, so let's talk about it. Everyone buys, rather than call it catastrophic insurance, let's call it stop-loss insurance. And basically, what it says is after you've expended 25% of your HSA, your insurance kicks in and pays everything after that in a year. Medicare contributions, those of us like me who have paid into Medicare, will be paid out the amount that they put in into their HSAs. Obviously, for us old folks, that's going to be a lot of money. $5,000 a year per adult is put into your HSA from tax revenues. Now, wait a minute. I know you're going, boy, that's a lot of money. Okay, let's do the arithmetic, and you'll quickly see that Direct Pay USA is much cheaper than what we've got now. $5,000 per person times 320 million Americans is $1.6 trillion a year. Current U.S. spending on our healthcare system now exceeds over $3 trillion a year. Now, with Direct Pay USA, there is no insurance, government or private, deciding your care. There is no pre-authorization process, no authorization forms that you don't understand, no denials. There's no regulatory burden such as Medicaid, Medicare, EMTALA, HIPAA, ICD-10. Now, you'll love this. There's virtually no fraud and abuse. Why? Because 99% of it is through the government billing system. There is no national overspending, and best of all, no government telling you or your doctor what to do. So finally, I promise you, what do we do next? Firstly, I urge you to visit the website wecanfixhealthcare.info. Look at some of the other webinars so you can be fully informed. And if you need to, just write down that URL, and that's how you can get access to all of the webinars. I urge everybody to read The Cancer in the American Healthcare System, which has all of this laid out for you and also has some great stories, so it actually humanizes what is a difficult situation. And finally, I urge everybody to demand Direct Pay USA, but only after you have reviewed all of the evidence in that book and have decided that that's the right thing to do. Thank you very much for your attention. This is Dr. Deane, wishing you a happy and healthy day.